Welcome to our show, Ask Your Doctor. I'm your host, Shivani Raj. For today's show, we have Dr. Neeraja. She treats all general disorders of kidney and hypertension, which is high BP, and holds additional training in glomerular disorders, which are highly specialized kidney diseases that are usually affected to young people. She also does genetic studies to detect genetic kidney diseases and also has a state of art dialysis unit that trains patients to do their own dialysis at home in case of a kidney failure. So, without any further delay, let's welcome her onto our show. Hello, doctor. I hope you're doing well.
Hello, Shivani. Namaste. I'm doing well. How are you?
Thank you so much, doctor, for joining onto our show. It's actually I'm very excited to have you. So without any further delay, can you please introduce yourself and tell to the viewers watching the show about what you do?
Of course. I think you gave me a very good introduction, so I don't need much more than that. I am Neeraja Tandra. I go by Dr. Tandra, and I have been practicing nephrology and hypertension. That's my specialty in Northern Virginia area for the last 11 years. Kidney diseases, kidney transplant, dialysis, with a special interest in pregnancy-related kidney disease and high blood pressure. Glomerular disorders, which is another interest of mine, are some of the things that I treat, but in general, anything that's related to kidney, electrolytes like sodium, potassium, and all those things, and high blood pressure, which is particularly difficult to treat high blood pressure. That is what I specialize, and like any other kidney doctors are.
Yes. So, doctor, is there any specific disorders that you personally specialize in? And, what are some problems and disorders that you generally deal with and you're actually a specialist in it?
So, in general, nephrology and hypertension is a specialty. So, typically, we are specialized doctors in treating chronic kidney disease or in acute setting, acute kidney failures. That's our bread and butter most of the time. Now, chronic kidney disease is any functional or structural abnormality of the kidney that persists longer than 3 months. So most of the time, chronic kidney disease patients are the ones that progress to need dialysis when the kidneys completely fail. And that's another entity of what we deal with on day-to-day basis. When the kidneys, we try to preserve the kidney function, deal with various stages of chronic kidney disease, which is main ailment that we treat. And dialysis is another major part, followed by kidney transplantation and post-kidney transplantation care. Apart from that, in younger population, high blood pressure, diabetes that causes the kidney disease, and electrolyte abnormalities. Those are the common ones to deal with. What I have in special interest in, and I have additional training with glomerular disorders with additional fellowship, is glomerulonephritis, which is inflammatory kidney disorders that affect mostly young population. And a lot of times these are treatable, reversible causes of the kidney failure, followed by genetic disorders that people are born with. And there are treatments that are evolving in order to prevent them from progressing to kidney failure. And the third interest of mine, and I specialize and have a good hand in forming Amyloid Center, is a specialized kidney cancerous condition called amyloidosis and multiple myeloma that is increasing in incidence. And that's one of my specialties. So I am the co-founder of Amyloid Center in Fairfax. And I also enjoy teaching. I teach medical students at UVA partly, but those are the main disorders. But there are several other, kidney-related, electrolyte-related, day-to-day things that we deal with. And one last entity is the hospital, where people are ill, sick, get admitted with kidney problems or kidney failure as a resultant of heart problems, as a resultant of infections. That's called acute kidney failures. That is another major part of our practice on a day-to-day basis.
So, doctor, hypertension is super common nowadays, and especially in South Asians. So, can you first explain a little about what exactly hypertension is and why is it really common, especially to South Asians and Indians? They deal with it. Like there's every other person has hypertension nowadays. So, can you explain why is it?
So, high blood pressure is increasing in incidence across the world. definitely more recognizable, more treatable and reversible cause in Southeast Asians. There is a significant amount of focus. I think a lot of it has been attributed to the lifestyle change that we went through, evolution, technology is developing, the physical activity is decreasing, our changing habits have changed. And a large part in younger population, unfortunately, is also from increased use of medications and psychological disorders that leads to treatment and medication-related side effects, environmental factors with pollution, the type of water that we drink, the type of food, and the source of the food that we encounter. So that's largely affected most of the Southeast Asian population, with an increased incidence of blood pressure at a younger age. And stress, the stress of competition, stress of work, the timings have changed, how we used to follow a certain rhythm. That is not the case anymore.
Yes. So, doctor, we also know that you deal with glomerular disorders. So, can you explain what exactly is it?
So, glomerulus, the kidneys are made of 1 million cells in each kidney that you're born with. And the kidney cell is called nephron. And nephron has two main entities that we deal with that can be affected with disease process. The glomerulus is head of the cell of the kidney, nephron, where the filtration happens, where your blood is filtered. And then there is tubular interstitial or tubular part where the urine gets concentrated and made. So the glomerular disorders are these specific set of disorders that are affected either from medications or infections like hepatitis that is rising, hepatitis C, hepatitis B, pollutants or pollution, heat. These things are affecting in genetic disorders that glomerular inflammation, causing the inflammation of the glomerulus, leading to glomerular disorder. And indeed, glomerular disorders now are recognized as one of the third most common cause in India and Southeast Asia as a cause of kidney disease that are increasingly recognizable.
Yes. So, doctor, let's talk about kidney problems. What is the most common kidney problem that a huge population deals with? And what are some kidney problems that you deal with your patients in general?
So across the world, the main kidney problems and commonest cause of the kidney disease is high blood pressure, followed by diabetes. Soon enough, diabetes is probably going to surpass and become the number one cause of the kidney disease. When it comes to particular Southeast Asia, India, and especially the Andhra and Telangana area, there's an increased incidence in Andhra area. So those are the main focuses for majority of the younger population that are migrating to America or other countries, as well as living in India, develop high rate of kidney disease, which is increasing in incidence.
Can you talk about what are some lifestyle changes that someone can incorporate in their lives for better kidneys? The Indians have a very different lifestyle compared to all the other, especially the Western countries. We have so much of rice on daily basis. We have so much of dairy on daily basis. Is there any way that these can affect your kidneys health? And what are some changes according to you that everybody must incorporate in their lives?
So lifestyle modifications are a very important part of, regardless of what type of kidney disease or high blood pressure or diabetes that we treat. To some extent, it's right that we have a lot of rice that is incorporated in the diet. But that's not the only limitation that we have with the changing lifestyle that is happening in India as well as outside with availability of the food, the broader perspective. So the number one, probably the factor that everybody has to pay attention to is smoking. Stop smoking. Smoking is one of the biggest risk factors to develop not only the cancer, which is well known, but kidney disease and kidney-related ailments and high blood pressure and vascular disease. So stop smoking. Number two is smoking is followed by vaping and substance abuse. You have to be cautious about that. That is increasing the incidence of high blood pressure. And number three is be cautious about the medications that you take. Number four, hydrate well, especially when you live in hotter weathers. That seems to be one of the major causes that causes the kidney damage, because Indians tend to have smaller kidneys because of the heat that they're exposed to. So hydrate well, careful about medications that you take, exercise on a daily basis. Of course, diet. The source of the diet, freshness makes a big deal of matter. So go for more fresher food. Moderation is the key. And more fruits and vegetables. Plant-based diet is definitely a better alternative to animal meat or animal-based diet. So that's been known and proven in multiple studies that it's kidney-friendly, heart-friendly to follow a low carbohydrate, moderate protein, and plant-based diet, which is actually what most of the Indian diet is. So making changes, less oil, staying healthy and active most of the time. Those are the most important things. And if you have diabetes and high blood pressure or a genetic propensity to develop kidney disease or heart disease, pay attention to your lifestyle, regularly exercise, regular doctor visits that you would have to keep up with in order to detect the disease early and treat it, including cholesterol, blood pressure, diabetes, keeping that good control over, is going to be all will result in a better outcome, even if you develop these conditions.
Yes. So, doctor, this is more like a doubt that I have personally. So nowadays, everybody is obsessed with supplements and, some extra supplements, detox, Botox, whatnot. But you did mention right now that taking excessive medications can also lead to kidney damage. So is there any way or is there any, can somebody get issues if they take excessive supplements too?
Yes, absolutely. That's been one of the big focuses where we are trying to educate, mainly see results in kidney stone formation. There's increased risk of kidney stones. People are traveling more, take large amounts of vitamin C. Ayurvedic medicine, some of the homeopathic medicine that is contaminated with lead, that has been an issue. And many medications cannot be combined safely with the medications that you may require to treat your high blood pressure and heart disease and other things. So, and followed by most of the commonly available medicines like non-steroidal anti-inflammatory drugs like Advil, Aleve, ibuprofen, people reach out to very quickly to treat their aches and pains. Those medications are the number one causes of drug-induced kidney disease. So supplements, you have to be very cautious. They're not going to go through the same scrutiny as the medications that you would take prescription-wise. So you will never know what the effect of them on your body is. And number two, you don't know what the effect of them and the interactions with the drugs that you already take for other conditions. So I'm traditionally, against doing any supplements in excess. There are conditions that you would require more medication or supplementation to be taken, but take it at the discretion of your doctor and advise rather than trying to reach out to the group companies that you take a lot of medications from.
Yes. So, doctor, you also do genetic studies. So, is it true that genes and kidney issues are correlated in any way?
Absolutely. So, it's related in every which way, whether you have high blood pressure, diabetes, or other chronic ailments also. Every person's genetic makeup determines how they react to the certain situation and how they recover. That's number one, but that's not the focus of the talk when we talk about genetic studies in the kidney disorder. About 11% of kidney diseases, especially in younger population, is secondary to some abnormality in the genes or genetic makeup or a mutation that they had. A lot of studies that are going on, we're making progress, but we do have genetic studies available to detect the common disorders that run in the family so we can be prepared to treat them. So there are about 365 genes that have been well proven to cause certain types of kidney disorders. Some are not that common in certain populations of the world, but we're learning more. So yes, genetic propensity is there, but what you can test really that would directly cause the kidney disorder is the genetic kidney disease like polycystic kidney disease that is also actually, we thought is uncommon in Indians, but it is actually a lot more common. And, certain deformities that people are born with, like deafness and everything, is related to the kidney disorder. So yes, you can be tested, but according to what your presentation is, your doctor will determine whether genetic studies currently available are useful in any way for you to know your risk before marriage, what your children would acquire, all those things. So yes, the genetic studies are going to play a bigger role down the road, but we're evolving. Currently, I do testing for certain populations only where there is an impact in the management.
Are young generation higher prone to kidney diseases and hypertension risks?
Yes, unfortunately, yes. There is more awareness, there is more testing, and there's more availability for the treatment. So there's more knowledge about it. So that's number one, but there is an increased risk that is associated with younger generation, just because of our forefathers that were, exposed to certain groundwater and chemicals and everything that had mutation, and they're passing it on. And the lifestyle that we have gotten ourselves into is another major factor that plays a role. Yes, there is an increased incidence. There's increased detection also in younger generation in terms of kidney disease, high blood pressure, heart disease.
So, doctor, is there any way that, are there any early symptoms that people can, recognize before they jump into conclusions? So, especially for younger generations, because I think every symptom is different for different people. So, is there any early symptoms that they can detect and come to you, to doctors like you, to, detect it earlier and maybe cure it in the earlier stages?
So that is the biggest challenge that we face in the kidney world, is the kidney disease is a painless disease. Unlike the heart disease, they'll have heart attack, they'll have pain, cough will, say something is wrong with the lungs. But with the kidney disorders, it's often detected in the blood test and the urine test. Very few people will have symptoms. The common symptoms that you typically see is leg swelling, abrupt weight gain, whole body swelling, facial swelling, shortness of breath. They notice like bubbles in the urine, blood in the urine. Those are obvious signs. And pain in the back, or which we call as flank, and the kidney area, recurrent infections, stones. Those are the ones that are actually dramatically present. But majority of the time, it's detected if there is a suspicion of high blood pressure at a young age or any abnormal age in the blood test and the urine test. So it's not a very dramatic field where we typically see somebody coming with a chest pain and we find the heart disease. So kidney disease is challenging in that way.
So doctor, can we talk about diabetes in relationship with kidneys?
Of course. Diabetes is, like I said earlier, high blood pressure is the number one cause of the kidney disease, and diabetes is actually approaching and is probably going to surpass as a main cause of the kidney disease. All diabetics, type 1, type 2 diabetics, are increased risk of developing kidney disease and kidney failure by the filter damage that happens because of the poor control and also because of the genetic tendency. So good diabetes control and good blood pressure control that comes along with the diabetes, and early detection of protein leak in the urine. That is common testing that all diabetic doctors and primary doctors will do. Any person who has diabetes should be checked, because that's an early symptom and sign of leaking protein in the urine. Fortunately, in the last 2 years, we have biggest breakthroughs in the kidney world, and we do have treatments that can reverse or slow down the progression of the kidney disease associated with diabetic kidney disease. So it becomes very important that you detect it early and you treat it early and you hold the progression of it is to the kidney failure where you would need dialysis or transplant. Yes. So yes, every diabetic should be tested periodically, once a year, if there's suspicion, more frequently with the urine test and the blood test.
Yes. So doctor, can you tell us how can hypertension and kidney issues affect a woman during pregnancy?
So high blood pressure is uncommon and increases the risk of kidney failure and heart failure in pregnant women. And the high blood pressure will also affect the blood flow to the placenta and increases the risk of premature childbirths, abnormal growth of the fetus and everything. So there is a big entity that we already know that patients have high blood pressure and kidney disease. They will be monitored much more closely during pregnancy because their risk to the mother as well as the fetus is very high. Now, there's a different entity where they don't have any problem before, but they're detected to have a problem of high blood pressure, which is called pregnancy-induced hypertension or pregnancy-induced diabetes. During their, whether it could be from mother's age, mother's conditions that she may be going through, but regardless of that, a good control of the blood pressure and prediction of that mother, that high blood pressure could lead to a fatal outcome in the last trimester when they're ready to give birth, that they could have seizures, they can have emergency excessive bleeding, that's called eclampsia, and preeclampsia risk are very high with the high blood pressure that comes in the pregnancy. So it is very important, and all pregnant women should be checked periodically. There's a first test that goes on at 3rd month, and they're detected to have any protein leak, or if they're detected to have higher blood pressure than what they should have for the first trimester, technically it should be low. They all should be very aggressively treated and monitored for the safety of the fetus, for the defects that fetus would have or the child would have, and for mother and her safety as well.
Doctor, can we talk about hypotension? We did cover a huge part of hypertension. So what is hypotension? This is also another common issue. So can you explain in detail about this?
Hypotension means low blood pressure. Now, low blood pressure is not as common ailment as high blood pressure, but it is technically a major problem, and it tends to affect majority of the people with endocrine abnormalities. That means hormone abnormalities that can be very life-threatening. So whenever people have low blood pressures and it's causing symptoms of slowdown, passing out, extreme tiredness and everything, they should be tested for thyroid disorders. They should be tested for adrenal disorders, which is a main gland that produces the hormones like adrenaline and everything that keeps you up. So those are the major entity that we deal with. And then there's a huge population of diabetes. Diabetics actually tend to have autonomic nervous system, which is the 3rd nervous system that's less known, is affected. So most of these people with these abnormalities can have extremely low blood pressures. And, sometimes of all these factors, low blood pressure could be a presenting symptom of a fatal cancer or underlying disorder like amyloidosis and heart disorder. So we kind of, extrapolate when somebody has low blood pressure, and their treatment is mainly directed towards, what could be the underlying cause. Sometimes it's telling you that there's an underlying cause to be detected and treated. Sometimes it's an ailment of diabetes or heart disease. But low blood pressure is definitely anything that's defined as less than 90 or 100 systolic blood pressure, or diastolic blood pressure, which is the bottom blood pressure, under 45 is definitely concerning for them to be tested further and treated accordingly.
Yes. I've seen like 1 or 2 cases like this. What happens is when someone with higher BP, they take extensive or like high dose tablets, and suddenly they have low BP, and there's a fluctuation happening all the time. Is this a good thing, or like is it common, or must people not do it at all?
So medication under supervision is important, right? So medication is intended to lower your blood pressure, not to cause low blood pressure. So now there's a difference between inducing a low blood pressure at the goal to protect your heart, brain, and kidney and from end organs being damaged. And then there is overtreatment. So overtreatment can happen, but it's not that common if it's done under supervision. So is there a treatment, when somebody also is on medication, if they're having other disorders like, diarrhea, some illness comes in, and then these medications are overworking, they could be damaging. So I think under supervision, I don't think there is an overtreatment of the hypertension. Usually the slow escalation of the medications, primary care physicians are very well trained with this. There's almost always a reason why the blood pressure suddenly has drastically gone down. So a supervised approach is important rather than going to the pharmacy and asking for a medication and taking it, because that's not the right treatment. So go to the person that actually knows, how to treat the blood pressure, like doctors, and do it under supervision. Always, that's the safe way of doing it.
Can you tell us some fruits or vegetables or some good supplements for healthy kidneys? And also, can you share something that you want to talk to the viewers watching the show right now?
Absolutely. I don't think there's a magic pill that would reverse the kidney disease and everything. There's a lot of propaganda about Ayurvedic medicine and some medicine that would reverse your kidney disorders. I would request all the viewers not to fall into that trap, but a good lifestyle. Kidney disease is a chronic disease for a majority of the people, just like diabetes and high blood pressure is. A good lifestyle. The source of food is very, very important, and that I stress to all my patients. The source of the food, where it's coming from, the shelf time of the food, and the freshness of the food really, really matters. So in general, low sodium diet, no additives or excessive salt and oils that you don't have knowledge about, don't use that. And, the farm to table time, that is the key. And that is the key for anybody to keep a healthy diet. So while there's no fruit or vegetable that could directly improve the kidney ability, all fruits and vegetables, all carbohydrates or complex carbohydrates, more to say, and plant-based protein is encouraged, but moderation is the key. Whatever you're doing, moderation is the key. So with the availability that you have to have moderation with your meals, with your exercise, with your calories. But farm to table time, at the two things I would say: fresh food, fruits and vegetables, incorporate a medley of things you have available. Availability is increasing, so make smart choices where you're not going for completely refined foods, canned foods, high preservatives that are added on, shelf time, longer shelf time. You should avoid all those foods. Go the old way, our Indian way. You have fresh fruits, vegetables, you have local meat that's not rancid, don't store it, eat less meat, more vegetables, more fruits. I think moderation, always farm to table time, moderation, two things I stress all the time. It's so much available everywhere in every country that you walk into. You have like all kinds of foods, Italian, Asian, you have so much available that it's hard to tell people, okay, don't eat this, or eat this. That is technically not possible. But I think you should really get to the basics. What our ancestors have done has worked always: intermittent fasting, healthy eating, intervals, exercise, moderation, and farm to table time should be lower and lower.
Thank you so much, Doctor, for tuning on to our show. We had an amazing show. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.